Hello and welcome back. This is Dr. Rock. The focus of this tutorial will be collegiate etiquette and our recently adopted student dismissal policy. So it is important to remember that professional interactions are required at all times by our students with faculty, staff, other students, preceptors, or anyone else you would come in contact through your coursework here at Frostburg. Make sure that you address faculty and staff using their correct titles. Faculty should be addressed by the use of doctor if they have earned a terminal degree, or professor. For staff, it is very appropriate to use Ms. or Mr. The purpose of our recently adopted student dismissal policy is to delineate circumstances or behaviors that are unacceptable based on the American Nurses Association Code of Ethics, the Frostburg State University Civility Policy, the Frostburg State University Code of Conduct Policy, the policy of the Department of Nursing, and situational circumstances as defined in this policy that would result in a student's dismissal from the nursing program. Such reasons for dismissal may include, but is not limited to, the following: a violation of the Frostburg State University Code of Conduct, substandard academic performance, HIPAA violation or breaches of confidentiality, civility infractions, and violation of the ANA Code of Ethics. It's important that you all know that Frostburg State University jurisdiction extends to all behavior by Frostburg State University nursing students that occur on campus, at university-sponsored activities, and community and practicum settings where the student is representing Frostburg State University. Related to the violation of Frostburg State University Code of Conduct, the university regulations are very explicit about behavioral misconduct, academic misconduct, and cheating. Please review in its entirety the University Code of Conduct, and we have the website located here in purple on your screen. In addition to the FSU Code of Conduct, the Frostburg State University Nursing Department holds the nursing students responsible to follow additional performance and behavioral regulations inherent to the profession of nursing. Frostburg State University Code of Conduct addresses multiple ethical and behavioral situations. In addition to what is defined in the Code of Conduct, the Frostburg State University Nursing Department has added the following additional components: disorderly or disruptive behavior. Definition is activities that may substantially harm the institutional reputation of the university. This includes behavior that results in removal from a clinical practicum site. Any behavior that results in a clinical practicum site rescinding their agreement with Frostburg State University Nursing Department as a practicum site, and any behavior that results in a preceptor rescinding their agreement with Frostburg State University Nursing Department to be a preceptor in the future. Violence to persons, physical or verbal assault. In addition to the definitions provided in the FSU Code of Conduct, the Nursing Department includes the following stipulations: engaging in a verbal argument with a preceptor, practicum site administrator, or nursing department faculty or staff that impacts patients, community, or departmental functioning, or institutional reputation. It also includes verbal or written acts, including on social media sites, that may be interpreted as inflammatory, degrading, or insulting towards a peer, preceptor, practicum site, patient, or Frostburg State University faculty and staff. Substandard academic performance. The profession of nursing requires retention of critical concepts and information with a dedication to continuing experiential learning throughout a nursing career, and is included in the ANA Code of Ethics. The ability to apply critical thinking and decision-making in high-stress environments is expected of the professional nurse. The Department of Nursing feels students who do not perform academically to our standards will not exemplify the profession of nursing nor Frostburg State University Department of Nursing expectations. Therefore, the following restrictions will be placed on nursing students in addition to the general policies of Frostburg State University as noted in the student handbook. All undergraduate nursing courses must be completed with a minimum grade of C. All graduate nursing courses must be completed with a minimum grade of B, with exceptions outlined in the graduate catalog. Starting effective fall of 2017, a total of 2 different nursing courses may be repeated during the program. A single course can be attempted no more than twice. Also effective fall of 2017, the program must be completed within 5 years from start to graduation unless a formal leave of absence is granted. Failure of 3 nursing courses may result in dismissal from the program, and students that are dismissed for substandard academic performance may not be eligible for readmission to the program. HIPAA violations and breach of confidentiality. The HIPAA privacy rule is a national standard to protect personal health information and medical records. There are strict guidelines that must be followed to protect the privacy and regulate disclosure of protected medical information. All students are required to undergo HIPAA training at Castle Branch and must be in compliance with these regulations at all times. At this time, that system is not yet set up, but will be in shortly. Students will be dismissed from the program and will not be eligible for readmission for situations that include, but are not limited to, the following: discussing protected patient information in a public setting, failing to maintain patient anonymity in documentation submitted to Frostburg State University, copying and/or removing protected patient information from a clinical setting, discussing protected patient information with anyone not directly involved in the patient's care, accessing any medical record of family, friend, or patient that the student is not directly involved in their medical care, providing protected patient medical information to any unauthorized person, failure to complete the HIPAA training annually, verbal or written acts, including on social media sites, that provide situational or circumstantial information unique to a patient case that may render the patient identifiable. Civility infractions. The Essentials of Baccalaureate Education for Professional Nursing Practice state that professional values and behaviors are the foundation for professional nursing practice. Professional behavior is based on the values of altruism, autonomy, human dignity, integrity, and social justice, among others. Each student is accountable for her or his actions and behaviors, including civility. nursing is a profession held in high regard by society. Therefore, students in the RN to BSN program are held to standards of academic and professional conduct that may exceed those of the general college population. Listed below are examples, they are non-inclusive, of behaviors that violate these standards. Any behavior that jeopardizes the safety of classmates, faculty, preceptors, or patients and their family members. Destruction of university or clinical agency property. Threatening physical harm to classmates, faculty, preceptors, or patients and their family members. Abusive, obscene, violent, or irresponsible behavior on university property or in clinical agencies. Falsification of university or clinical agency records, and use or abuse of alcohol, illegal drugs, or prescribed drugs that alter the student's ability to perform duties related to clinical assignments, or presenting at the clinical site in an impaired condition, such as under the influence of drugs or alcohol, without sufficient sleep, or physically ill. Violation of the ANA Code of Ethics. RN to BSN students are expected to follow the ANA Code of Ethics in regards to their nursing practice as a student in the classroom and clinical setting. The ANA Code of Ethics with interpretive statements can be found at the link in purple. Violations of the ANA Code of Ethics includes but is not limited to the following: failure to practice with compassion and respect, with sensitivity to diversity and personal choice. Failure to act in a way that demonstrates commitment to the patient. Failure to be a patient advocate. Failure to accept accountability and responsibility for actions consistent with the profession of nursing. Failure to promote health and safety of yourself. Failure to adhere to ethical, environment, and conditions of attendance in clinical sites. Failure to advance professionally and intellectually. Failure to collaborate when appropriate. And a failure to maintain the integrity of the nursing profession. Dismissal process. If any infraction occurs, the Student Conduct Committee will be notified by the reporting party in writing of the events associated with the situation. The committee members will make every attempt to interview all involved parties. The student may be required to appear on campus to meet with the committee. The committee will determine if the act or behavior violates any of the student conduct policies of the university or specific to the requirements outlined in this policy. If an infraction was determined to have occurred, the student may be dismissed from the nursing program and/or Frostburg State University. The student will be notified of the committee's decision. The Office of Student Affairs will be made aware of all such incidents. The Student Conduct Committee may elect to place the student on probation in lieu of dismissal, provided the student's infraction does not violate any federal, state, or local laws and is willing to agree to a remediation plan. The events will be part of the student's nursing departmental record. The student may not be permitted to enter the honors program even if meets academic criteria and may not be issued a letter of recommendation. Last, the appeals process. Students dismissed from the program may submit a written appeal of the dismissal to the Office of Student Affairs according to university policy. Academic appeals should state any extraordinary circumstances that resulted in the student's dismissal, how the circumstance was resolved, and the student's ability to fulfill the requirements to complete the program successfully. Conduct, confidentiality, civility, and ethical violation appeals should explain how the student determined that the infraction was not in violation of the policies of FSU or the Department of Nursing. Thank you very much for your time.